So I'm Dr. Ben England here with my colleague Dr. Raymond Butts. We're really happy to have Dr. Jerry Yu here on the webinar series with us. We're going to really be talking about how Jerry has cracked the code when it comes to treating the aging athlete, and really just anybody over the age of 30. At least that's what I think your target patient population is. And Jerry, you've been super involved with a lot of things to do with HYROX. Your
Yeah,
practice is exploding right now. Jerry's both in North Carolina and New Jersey. So, without further ado, I'd like to introduce you guys to the Next Level Physio, Dr. Jerry Yu.
thanks a lot, Ben, and thank you to you and both Ray for having me on.
Of
So,
course.
Jerry, walk me through a little bit. What has life for the past 6 months been for you? We had you on one of our New Jersey orthobiological hacker events. What has life looked like since we last updated with each other?
Well, let's see, a lot has happened, and a lot of good things as far as us just solidifying our model and whatnot, and learning a lot from you guys, of course, and implementing some of the OBH knowledge into what we do for our shockwave, and making it that much more of a valuable asset and truly modality for how we treat patients to get them better faster. So we have our location in Wycliffe Lake, which is our original location, and Montclair, which is our second location in New Jersey. And we opened up our Cary location 2 years ago. And about 8 months ago, we opened up Raleigh. So it's been nice to expand in that direction and seeing how we can impact the lives of people that we come across.
Awesome. Well, update me on all things HYROX. I often see
Yeah,
many of your great Instagram clips and
thank you.
Instagram reels. If anybody in the future and others listening right now in the Torrentia tribe, just make sure you give Jerry a follow because you may pick up a few things. Walk me through what's been going on with HYROX with you.
Thank you. It's funny because I started my HYROX journey mentally about a year and a half ago, 2 years ago, and it was because a patient of mine was talking about HYROX, and I didn't even know what that was. And he explained it to me, and I said, "Oh, it sounds like something kind of like a fad sort of thing, like CrossFit or something like that." So I didn't think too much of it, but it sounded really hard. And so as I just did some more research and got into it over the last year or so, I began to meet some pro HYROX athletes, and we've actually worked with them and treated them in our office. And it made me think about myself where I just love doing hard things, Ben, which I think you know. And so I was like, well, this is something that's hard. I do all the things in HYROX, whether it was lunge walks, wall balls, and of course I run. And so I thought, well, it's just all the stuff that I normally do combined into one thing. I wonder how I could do with this. And one of the pros I talked to, she was like, dude, like in your age group, you could probably do pretty well. I was like, really? So that sort of got me even more interested in exploring this. And so now I'm on month 4 of my official HYROX training. I have a coach down here, Stephen Pulkifer, who is a high level guy, and Karen Guidry, who does my nutrition. So they've been really helping me sort of like get to this level where I can compete in New York, which is going to be in June. And I'm excited about it because number one, it's in my home turf, I guess you could say, in New York, New Jersey. And number two, it's going to take a lot out of me, but I just love to raise the bar of what it can do. So I'm looking forward to that.
Awesome.
Honestly, I have to have a knee surgery here in April again,
Yeah.
but I
Fuck
cannot
it.
wait to get it over with because all I want to do is those high rocks races. Like I
Are you
that
serious? Oh
oh
my
my
God, I
God,
didn't know that.
that is so me. Like I honestly I can't stop thinking about it. I can't stop reading about it. Like all I want to do is
Oh my
get through
God.
this because
Yeah.
yeah, I think it is the coolest thing, and it completely matches like my approach to like workouts and fitness. So
Well, I mean, they had one in Miami recently, I think, too.
yeah, no, they
Yeah.
did. There's no way that I could do it right now just because I have too much pain. But I much
Oh, jeez.
respect and yeah, hopefully maybe we can do one together at some
Oh
point.
my
That'd be
gosh.
awesome.
Ray, that'd be amazing.
I mean, I'm in the old man age group, but you know.
Well, so am I, man. We'll do it together. We'll rock it out, man.
Awesome, awesome.
So,
Yeah.
Jerry, walk me through a little bit. So, I
Yeah.
kind of did a deep dive into Next Level Physio, looking at
Yeah.
how you practice and how your team is different. And you guys offer a really unique approach, both combining regenerative medicine programs alongside of, shockwave treatments, alongside electric dry needling. And really, you're kind of walking the walk. What does that
Mhm.
look like for new practitioners that you bring in for Next Level Physio? What is that? Oftentimes it's a little disorienting, for people to walk into a different model.
Yeah,
But the model works, right? You guys have treated over
definitely.
3,000 patients now, maybe even
Yes.
more. But walk
Yeah,
me
for
through that a
sure.
little bit.
Definitely. Well, so when I got into the practice on my own, I wanted to figure out a framework that would work for both patients and to be able to guide our clinicians on how to direct their care. And simply, it's our Move, Excel, Inspire method. And our first phase would be basically helping to retrain the brain, getting movement back in order, and helping people to get better motor control, along with getting rid of the pain. And then our phase two is basically that subacute phase where we're looking to strengthen and stabilize things that need to be stabilized for, to set the right foundation so that people can get back to what they love to do at speed. And the good thing about adding the regenerative in there, and also including dry needling and BFR, is that it helps us fast track through the phase one. So when we onboard a patient, the first thing we say is, listen, our typical plan of care is about 12 visits or so. And the better that you do, the less I need to see you. But here's how we get people better faster. And that's by incorporating these different tools like shockwave, the two different types, and also electrodry needling and BFR. And we just throw everything at it, knowing that we want to increase blood flow, we want to be able to reduce pain, and actually have a device that can really heal tissue at a deep level that we can't with our hands. And when we explain it to that way to our clients, who are often high-level people, they want to just get better faster. It's a no-brainer for them. And for our clinicians coming on board, whether they're new or they're experienced, seeing that new technology for them is exciting because number one, the research behind it is very solid, as you both know, and seeing the results and how few results you can have to get a response from someone is massive. The cool thing also about our approach is that we also tell patients that listen, the shockwave is definitely helpful, but if that's all you do in your rehab, that may not be the complete picture of what you need to get. We need to correct the movement patterns or the imbalances that got you here in the first place. So they work in tandem to get you to the result faster so that we don't just treat the symptoms with the shockwave. We actually want to try to get to the root cause of what's happening so that as we get you onto this track of doing well, we can maintain those results and not have you go back to step one.
So 12 visits is a pretty typical plan of care, that we see. And I mean, I think you would agree. I mean, generally what we see is as people add shockwave and other modalities, you're cutting that by, 33%, and sometimes they
100%.
continue to come in for the full length of that plan of care simply because they do see the progress and they're trying to maybe overcome another barrier. They come into you with a different problem, their shoulder
Exactly.
starts to feel better. Well, now all of a sudden that nagging knee thing they
Happens
start
every
to
day.
bring up.
Exactly, and it's funny because we often tell people that sometimes they'll feel, let's just say if we've expedited their progress and they start feeling really, really good by visit eight or so, then we'll say, hey, listen, let me see you next month, but here are the things I want you to work on. Let's just really test this out before you go to your HYROX event, before you go to your next triathlon or marathon. And so that gives them the opportunity to test things out, and if something comes up, we can stay ahead of things so that they don't fall out of the system in that way.
Awesome. Well, walk me through a little bit. I'm going to go kind of in the Wayback Machine here. You started the Next Level Physio podcast, and you've really had a lot of interesting people. You've had,
Yes,
some patient testimonials. You've had some pretty incredible
you
people. I
did your
actually went
research.
back and looked looked through it.
Yeah.
Walk me through why you started the Next Level Physio podcast and what that really has looked like for you, and then how has that changed your practice?
Oh, I'm so glad you touched on that. I would say that and it's funny, I started the podcast for selfish reasons, and it's because I am terribly shy on the camera. And so I wanted the reps in having a controlled environment where I could work on this skill and try to get better at speaking, and also as you get better at asking questions over time. And then I wanted to also use that as a way to create relationships with local businesses. And we have several partners who we're still partners with because of that podcast, where they have referred patients to us and we refer patients to them. They come themselves as patients. So it's been an interest. That was an unexpected benefit from doing that. So that was really cool in doing that. And also what we do with that is we'll take the episode and we then will provide the transcription and a summary of the uh, clips of what we've taken from the podcast, and then we'll send it to the partners as well so they can use it for their own social media stuff. And as far as interviewing our clients, it was our way of spotlighting people who've had success. And what we do is we'll take those clips and we have them organized by attributes. So age, sport, gender, all that stuff, why they came in. And then if we have someone on the phone calling a new patient, for example, or somebody who's inquiring, we will then say, hey, listen, you sound like Jane. let me send you a quick clip of what Jane did so that you can, basically get information from her to know that we are the right fit for what you have. And that's been really helpful in helping clients feel more confident that we are the right solution or will provide the right solution for them. So it's evolved over the years where I'm just trying to get more, even more, I would say, uh, guests out there who are doing things that are in the health and wellness space, just because I'm more interested in those things too for myself. And so it's been interesting to get on that track towards getting to know more people over time.
Awesome. Well, walk me through a little bit if you don't mind. So
Yeah.
your patient journey, you've outlined really well. You're kind of onboarding new people, really how you're marrying technology. When was the first time that you started adding, really regenerative, programs to your business? And what does that look like from a patient experience standpoint?
So I'm gonna say we started as early as maybe 10 years ago. And we started off with the BFR. And then I came across, I was always wondering, like, I wonder if there's anything out there that could actually, heal tissue that's not a massage gun, that's not something that people could buy. And as I dove into shockwave, I was like, this is crazy. There's actually something out there that can do this. And what was really cool was using that tool to and showing this to clients as far as like this is what it should be able to do. This is based on the research and what it can do. It's helped a lot of patients actually see that, oh, so there's more to physical therapy than just ultrasounds and using e-stim pads. It's like, yeah, there's a lot more to that. But here's a device that can really kind of get you the results you're looking for. And so when we started implementing it into our practice, seeing people get fast results was the biggest game changer for us. Seeing it actually happen in real time then too was like, this normally would have taken me probably twice as long to have the person get some benefit. But having that fast track allow for our clients to not only tell the doctors, but also their other friends, stuff like that. Hey, they got this device that kind of hurts at first, but like, my pain went away, that sort of thing. It's sort of like gets a lot of curiosity going in different populations and friends of his clients who are like, well, I want to try something different too.
Yep. Well, we had a discussion, back in July, I believe. No, it was October. We had a discussion on peptides, and we were really
Yes.
talking through the peptide supplements, exosomes journey. Where does that fall within the ethos of maybe even your own personal journey with
Yeah.
HYROX, but then also our patients are asking about it. They want to know more information.
Yeah.
What are you doing to try to really steer them in the positive direction when it comes to peptides, exosomes, et cetera?
Yeah. I would say it's typically our older athletes over 30 or 40, Ben, where they're constantly complaining, especially the high level guys and gals. They're complaining of always being tired. They do all the right things. They sleep well. They're eating well, eating enough protein. They manage their stress levels. They have good recovery days, but they just don't feel like they have the energy to continue on doing certain intensities. And so what I ask them always is like, have you heard of peptides? And oftentimes they just hear about it. And so then I just tell them from my own experience, having used Samoralin and PPC, that it has really made a difference in my performance and my rest and recovery between sessions. And so then there are a couple of people that we know in the community locally that we just say, hey, there's a game day health. They have Samoralin, and they have all the things that you might want to be curious about. So we send them there as a way to enhance what they're already doing, not as a cure-all or not as something that you should just do and not do anything else with. So using that as an enhancement to what they were doing is what we try to go after. And I mean, I think it's within our scope to just bring up the options that they have. Say, hey, these are things that, although not all of them have been proven scientifically, at least the ones that I know of are for human use, are very effective in helping people become more recovered from their activities.
So that then leads into the next question, which is GLPs, right? GLP-1s,
Yeah, yeah,
semaglutide and the
yeah,
tirzepatides and some of those
yeah.
peptides. What have been some barriers that maybe you've run into with people who may or may not be utilizing those peptides?
Yeah, thankfully we don't. I actually haven't personally come across anyone who's had to use GLPs, and maybe it's just because of the population that we work with. Um, the only barriers that I know of are whether or not it's indicated or not, and how physicians are getting around that, perhaps. But yeah, I don't know enough to really comment on any barriers to those peptides.
Sure. Ray,
How
do you want to chime in a little bit on that?
me?
Yeah, on
Oh,
GLPs.
I wanted to ask a question. Well, it was a different question, but we could return to that if you want. Well, I've been doing a lot of reading, obviously, for our courses and just to
Yeah,
answer questions from students about, a lot of the peptides get the most hype. But my question is, because it sounds like you're really using them a lot, and especially for athletes that have injuries and now they're trying to get back into action as quickly as possible. Most of what I read, though, really is saying that peptides really shouldn't be used during the inflammatory phase. That
I've
it's
heard that.
really not until you get into the tissue repair and the remodeling phase that they're really key. So I guess my question is, can you speak to the what timing you have seen work best when it comes to these peptides?
I know Samorland was recommended to me that where I was taking it at night before you go to bed. So regardless of whether or not you're going through any kind of acute inflammation or anything like that. So that's the only guidance that I know of as far as that goes. And BPC was just as a supplement too.
Yeah, yeah. No, I
Yeah.
guess I was talking more about the BPC 157, the TB 500, like
Yes, yes, you found, yes, exactly. I wasn't given
this
any
stuff.
specific instructions as when to take that. It was more just take this every day. But that's that was the information I got at the time. Might have changed since then.
No, I think my words are not coming out
Oh,
well, but I guess what I'm asking is when you talk to patients about them and you talk about
oh,
using them, like
yeah.
how soon after they have an injury,
Oh.
do they start taking the peptides where you have seen the best outcomes?
I see. I haven't seen a result as far as when taking the peptides is most beneficial in the injury recovery scheme. But
Mhm.
people who often ask about them are just wondering about ways that they can just feel better faster between workouts. I think is more what they ask me about.
Yeah, and the
Sure, got it.
conversations that I've
Yeah,
had, the BPC 157, the TB 500, the semi, or Samoralin, and others, really avoiding it during the initial, inflammatory cascade. So first 7 to 10 days
yeah,
is generally recommended, and then, they can resume that as well. And the same goes for any sort of anti-inflammatory or anything that's trying to mitigate
yeah,
that
for
process,
sure.
because the peptides, Ray, I mean, I know this is they're really trying to help with the building phase. They're really trying to support the tissues as they're going through that process. And many times with shockwave and even dry needling, we do temporarily, cause a newer injury, and we do jumpstart
Mm,
the inflammatory cascade, and those things do seem counterproductive, at least towards the literature that I've been reading.
It's
I see.
true,
So
but most of
yeah.
the literature that I see really talks about, I feel like it's more of a theoretical thing instead of a hard science thing, right?
Yep.
Because,
Mhm.
I mean, if you look at the way that we treat, patients that in that inflammatory phase just to help to control the inflammation, right? I mean, we do a ton of stuff which is anti-inflammatory, right? So it just, yeah, okay, you're doing it systemically, but to suggest that these peptides are going to have such a huge effect that they're really going to prevent or stop important inflammatory processes is kind of a hard sell for me. So, I mean, my
Yeah,
question to Jerry just was, if he was using those in practice, just, if he had noticed any trends or, if
yeah,
in terms of timing and when was
yeah.
best to start taking it, I didn't mean to put you on the spot. It was just something I
Oh
was
no, no.
thinking.
Yeah. I didn't know there was actually an ideal time perhaps to take the peptides if there was one. But that's good to know.
So you
So then
mentioned,
would you guys
oh,
recommend then
sorry, go ahead,
would you guys
Jerry. Go
recommend
ahead.
that's okay. Would you recommend then if we do apply, say, using shockwave on somebody with an acute injury, that would probably want to wait about a week or so after the acute initial acute response has occurred after using shockwave before we have them take something like a peptide or anything like that.
I mean, Ben, do you want me to? I mean, I think it depends on the peptide,
Sure.
right? I mean, I think it's a different story when it comes to sormelin or some of that stuff, which is more, like growth hormone related.
Yeah.
I think the larger question is the BPC 157, the MOTS-C, the TB 500, that sort of stuff, right?
Yeah.
And
Got
I
it.
think when it comes to shockwave. it is fair to say that there is an initial inflammatory event, which kind of sets the extracellular space up for angiogenesis. But I feel like it's pretty short-lived. And I can't imagine that, taking some of those peptides in concert with shockwave or laser is really gonna make too much of a difference. In
What
fact,
difference? Yeah,
I think as long as you're in the appropriate stage of healing, I see it as being additive.
yeah,
In my opinion, from everything that I read, it's really, if you think about our iris method, right? Yeah, you don't want to do it in the inflammatory phase, perhaps, but as soon as you're starting to regrow tissue, repair tissue, remodel tissue, that's really the sweet spot. And if you're using it with shockwave and laser during that time, I say go for it.
yeah.
I mean,
That's
Ben,
good to know.
feel
Thanks.
free to disagree if
No,
you've read something else, but
no, I'm in agreement with that. So, Jerry, your primary population is really the aging, athlete. I love that marrying of words because really anybody who wants to have any level of fitness is generally an
Yeah,
athlete until they decide that they're no longer an athlete.
absolutely. Yeah,
And walk me through that journey as you come alongside patients who are not just trying to get their health back, but are also trying to begin a new season in their health, especially as they're aging.
yeah. It's funny, Ben. I am now in the age group of being the aging athlete, so I understand my avatar very well. It's funny because if you ask me in my 20s and 30s, what I would do for an injury, I just walk it off and put some ice, even for myself as a physio, right? And what I realized in my 40s was that I started to notice that I couldn't train like I did in my 30s. Now that I'm 50, I can't even train like even close to what I was in my 30s. And when I go to these HYROX classes, I am gassed. That is crazy. So it's been a very humbling journey for me to just finally come to terms with, yes, I can push hard, and yes, I can probably go for PRs, but I'm going to need a little bit more recovery between rounds in a given class, for example. And I'm going to need a little bit more rest and recovery between even sessions like this. And so when I can speak this language to the clients that I work with, they're like, oh, you get it. You understand me. So there's almost like this really, it's almost like, I don't know what the word is. Basically, they feel that there's alignment there. And so they know that I'm going to have their best interest in how we progress them. And they're more apt to listen to me because they know that I'm living the life that they're living or they want to live. And so they know, well, if Jerry's doing this and he's in his 50s, then I should be doing this too because it works for him. And it basically creates a lot of credibility and authority at the same time and trust in the people that I work with. And if you ask me, like, I don't know, in my 30s, if I ever saw myself working with people in their 50s and 60s and so on, I'd say, nah, more of like, post-op guy, whatever. But I really enjoy this population because they're very serious about their health, just like I am. And they're like, Jerry, I just don't want to not be able to golf, to play hockey, or to pickleball, to do HYROX. I don't want to be limited. And I was like, I get that. I could resonate with that so well. So I think that has changed my perspective a lot over the years of who I like to work with and who I'm the best fit for, probably.
Well, you personally cited nutrition in your own world. I often find in my own practice that poor nutrition far sabotages more of my patient's progress than anything. How does that conversation look with your patient population? Because I feel like nutrition it's talked about, it's glossed over. Yes, I know fruits, vegetables, but what does that look like in terms of rehab with your patients?
Yeah, I mean, I tell patients often, well, the first thing I do is ask them if they track their macros, and 9 out of 10 times they don't. And so then I'll actually, in our discovery session, I'll say, let's just kind of go through what you ate today. And I'll literally write down on the board on the paper, kind of like what they ate and sort of guesstimate what they had. And typically it's way below what they should be consuming daily. Depending on who you follow, I do follow some of Peter Attia's recommendations where 1 pound of, or 1 gram per pound of body weight. And when I know some like a high level athlete or somebody who's an endurance athlete, they're just running through their system very fast and they're breaking down really fast. So I often tell them, hey, listen, if you want to recover better, the first thing I would say is you got to get more protein in your system. You're not even close to what you should be consuming on a day-to-day basis. And it's funny how people's perception of that is different than where they're, obviously, well, I have this and I have this and this. It's like 100 grams. Like, no, that's like 20 grams, man. You're way below what you should be consuming. And
Yep.
so it's when I point it out to them, they're often shocked and they're like, wow. So all I tell them, hey, listen, just track this for a week. You don't have to go nuts on, the quantity and stuff. Just you just get into the habit of consuming this, and then let's just start at that point measuring things out over time because you first have to get into the habit of consuming that, of consuming enough protein before we can start adjusting things along the way because they're just not used to having that in their diet. But I just see a massive improvement. I was this funny story I shared the other day. I had triathlete who was training for an Ironman. He was getting this constant like pain in his quad, and he'd done all the right things and everything. We saw him for recovery, and one of the things I asked him, tell me about your protein, and it was about 10, 20 grams a day, Ben. And I was like, Mike, don't do anything else. Like, just boost it, boost this up for a couple weeks, see how you feel. He called me in 2 weeks. He's like, I just feel amazing. I was like, dude, you don't have the right substrates in your system to even start rebuilding after all the stuff that you're doing. You need that to recover. And it's the same conversation, Ben, that I have with post-op patients, where it's like your body needs protein to heal. You really need to build, to build from. So if you don't eat enough, it's gonna slow down the process of recovery. And we try to really make that a part of our conversation, especially when they first come in, because that's when we'll have the most impact and letting them know it's really serious that you take it under control. Your ability to recover from this injury or from the surgery is going to be predicated upon how much you can consume on a daily basis, your calories and also your protein to make that environment happy or healthy for recovery.
Yeah, I definitely would agree with you on the protein intake. The other thing that I see, because I see a primarily, we'll call it just chronic pain, or long-term, long-standing pain issues. People have had pain for 5 years or had headaches for 10, and, they're really seeking care. And being in Fort Wayne, Indiana, vitamin D is a big one that most of my patients
Yes.
are deficient in. And
Yeah.
I did start, adding that to my screening questionnaire is, do you
Yeah.
consume a vitamin D, supplement or multivitamin on a regular basis? If
Yes.
so, what do you take? Just to start
Yeah.
incorporating that more because vitamin D deficiency is a known cause of pain. Ray could probably go more into the mechanisms on why that
Yeah.
is, but really looking at things at a 10,000 foot level, if our patients are training and they're the elite athletes and they're the aging adult and their protein consumption is poor, there's
Yeah.
no exercise or intervention we can do in the gym to remedy that solution or remedy that
Yeah.
issue.
Absolutely. It's funny. We actually give our clients a list of things that these are the things that you have control over. Your sleep, your nutrition, your stress levels. These are things that will definitely affect how the rehab goes. So that if you don't have ownership of this, I can't guarantee you're going to have the best result from what I do with you also in our sessions.
Definitely. Go ahead, Ray.
Oh, I was just gonna say we don't have any problems with vitamin D in Miami.
Or North Carolina for that matter.
But one question that
So,
I did want to ask that I certainly get asked a lot in clinic is about hydrolyzed collagen. I was just
ah,
wondering, is that a conversation that you have with your patients, and
yes.
what do you think?
So I've gone back and forth on this, especially in the literature, where I've seen evidence for and evidence not supporting it. But I do tell clients like it's if anything, it's not going to hurt you. But there seems to be evidence that adding collagen, especially if some joint issues, can be helpful over time. So I have them take that in as part of their protein intake as well, because oftentimes it comes in with some sort of protein supplement. But that's the step that I know as far as how can it be effective. How about yourself, Ray? What are your thoughts on that?
I actually have seen some really solid results. I from reading the literature and what I have seen, I do think that timing is important. In other
Mhm.
words, when patients are taking it with respect to their treatment or with respect to their training can be
Yeah,
a thing, right? So it's almost like they're really supposed to load it about 60 minutes prior to make sure that it's kind of on hand for whatever it is that they're
yeah.
doing. And then of course the other big thing is making sure that you're doing it with vitamin C, right?
Vitamin C, yes. Remember
And
that.
then
Yeah.
vitamin C is available. So it's these little things that I think that aren't talked about quite as much that can be a huge difference.
Yeah, and
Yeah,
for
definitely.
patients who have, more connective tissue disorders, like the Ehlers-Danlos, type or other connective tissue, issues like Marfan syndrome, et cetera. It's also
Yeah.
recommended to couple that with hyaluronic acid for those patients, with the vitamin C and the hydrolyzed collagen, and
Yeah.
doing that 30 to 60 minutes before exercise, just sort of long standing before exercise, because their bodies don't necessarily have the ability to synthesize proteins well, specifically proteins associated with connective tissue. And I really do see that quite a bit in the literature.
Ray, wasn't there a study with the vitamin C and the hydrolyzed collagen with I thought it was with either patella tendinopathy or Achilles. I could be wrong. There was some study done specifically with that regimen that maybe it was published maybe a few months ago.
So I'm pretty sure it was on tendinopathy, but I don't
It was
remember
tendinopathy.
which one.
Yeah,
Yeah.
I know that the Gatorade Institute actually did a pretty big study. I believe it was for Achilles tendons, where they married those, three about 30 minutes before exercise and compared that to
Yeah.
a group that did not, consume the supplement, and the results were fairly profound. But I believe that was for anybody in the call. I believe that was the Gatorade Institute that published that study.
I will
Very
say that
cool.
when it comes to hydrolyzed collagen, that there are really only two types of problems where all the evidence exists, right? So it's either patients that have connective tissue issues or there is emerging evidence for osteoarthritis. So joint related stuff.
Yeah.
So I mean, I do think that that matters too, right? Just, obviously, as you said, I don't think it's something that can hurt, but honestly, all the evidence is there right now.
Yeah. Is there a brand that you guys recommend? The one that I came across is Vital Peptides that you can just get at Costco. But I don't know if you have one that's specifically that you guys have used that's been more beneficial.
I think the one that I recommend to majority of my patients, now I recommend quite a few things from Full Script for my patients, mainly because of the third-party testing, the CGMP
Mhm.
certification, the physician approval process that they go through with Full Script. But previously, it was a supplement called NeoCell, and NeoCell had either a liquid form or a powder, form that patients could take. But I found that that had the best combination, and I believe it's 15 grams of collagen, 5 grams of the hyaluronic, or 5 grams of the vitamin C, and then there's, I believe it's 1 or 1.5 um, grams of the hyaluronic acid.
Oh, that's nice. That's good to know.
Jerry, can you talk a little bit about the since you're doing shockwave and laser and obviously you're doing functional medicine stuff, like I would say one of the big barriers that we have seen with students and certainly a lot of questions that we got at CSM was trying to figure out how to incorporate these amazing tools given an insurance model, given a hybrid model, given a cash model. So
Mhm.
I'm sure that a lot of people would really like to hear, since you're doing it
Yeah.
really well, what your model looks like.
Sure. We currently work with Blue Cross Blue Shield in North Carolina, but we will be dropping it very shortly. But that being said, for clients who needed something more than just what we could do with standard physical therapy, when we added the regenerative, we had that as an upsell to their program. So the way we phrase it is that, hey, listen, just like I said before, you'll get great results with physio if we just focus on things that your insurance company covers. But if
Sure.
you want to get there faster, this is the best way to do it. And that's what we talk about. We have our shockwave, BFR, electrogyne needling. These things aren't covered by insurance. So we charge an additional fee for that. And again, if we frame it the right way and we tell the clients that this is the best way we can get there at speed, then they're often opt to just wanting to go opt into it. So that's been the approach that we've taken with as far as that goes. When we have
So
a cash client, sorry.
I'm sorry. I'm sorry.
Oh, yeah. With the cash clients, we had originally had them incorporate into their sessions, but we're now actually basically breaking them out so that we're decoupling them so that there's a program that's like our premier program where, this will cover everything, including dry needling and BFR. But if you want to get the regenerative stuff, which actually heals tissue, there's an option for you to purchase this at a separate rate too, on top of what you do for cash. And the reason we're doing that is because we found stuff, basically this stuff is what really helps a lot of people get through that phase one. And although it'd be nice if we include that with everything we do, we also want to work with clients who are ready, willing, and able to pay for those services. And so it made more sense for us to break them out and offer them as something separate. Also knowing that, a lot of what we do in our sessions without the regen still will be very helpful and it'll be very customized to the client, but this added bonus is something that we want to try to incorporate as an addition.
Sure. So,
Yeah.
I mean, I know that you're in New Jersey and, each place is kind of its own separate animal, right? I'm in
Yeah.
Miami, Ben's in Indiana. But I guess, are you are you able to bill anything at this point to insurance? And, I obviously don't have to give me the details, but I think a lot of people would be very interested just to hear about like what your typical packages look like.
Sure. For with physio or for the regenerative stuff?
With the regenerative stuff, I
Yeah.
was
Got it.
more
Yeah.
focused. Yeah.
So I was well the our price program right now, our base program is it starts at like 3108, I think 3000 and change. And that's for 12 sessions. Or you can pay 295 per session as you want to go. And for regenerative, it is at not 199 per session. But then if you buy a program, you can reduce that as a volume discount to we're looking at 150 right now as if you buy six or more, then it's at this price. And typically patients don't seem to, at least ones we've come across, haven't seemed to have much uh, objection to it because we explained ourselves enough to do that. But for those who are on the fence, we just say, hey, listen, why don't we try physio without it first? And if we find that we get stuck, why don't we consider going this other route? Because I don't want you to waste your time. I want you to get the best result. And so that seems to be helpful as far as helping people to make that decision to get the regen there.
I know that there's a lot of clinics that do like a show and tell sort of program, like
Yeah.
let me show you that this is really worth it. We're going to incorporate this into one treatment. Let me show you that I can make a difference, and this way you're happy to buy in. I assume you do something similar.
Yeah, we do if we need to, Ben. I'm sorry, Ray. I would say that 9 out of 10 times we don't have to because
Wow.
we've shown so much value in discussing and talking about how beneficial it is and what the education is in that piece that they're already bought in from the get-go. So hey, let's just go for it. But for those who are on the fence, I'm saying, hey, why don't we try one session at a time, see how you feel. But to your point, when we do that one session, typically they're like, okay, sign me up, they're ready. We do a test and retest, of course, and like I can't believe how much better I feel in 10 minutes. So like, yeah, in fact, I was actually at an event at Fleet Feet. One of our partners, they have an event every year, and
That's a
so
good
I brought the
marketing.
Shockwave. Yeah, and I said, hey, listen, so we had a gal come in with medial shin splints chronic and a high level runner, and so I did a test retest. I was like, okay, let's run with it and let's run without it, having done the procedure, and she was like, oh my God, it's much better. It's like, yeah. So she just came in today for her evaluation because she was bought into it, and so I'm sure she's going to have a good result. But yeah, that's been very exciting for us to be able to show the public that there's something other than traditional PT that can help fast track their progress to where they want it to be.
One of the things that
And so
I,
when student,
oops,
yeah,
sorry, go ahead, Jerry.
oh, when students see it in action, they're like, oh my gosh, you have this. It's really cool because they don't see it in grad school, which I'm like, this needs to be a standard of care that needs to be taught in graduate school, and it's sad that it's not there yet. There's plenty of research. I don't know.
We're
I
trying.
can't believe they're practically still using ultrasound, but that's just me. But that being said, there's something that actually can heal tissue. It should be part of curriculum all across the nation.
I just did a webinar yesterday with Dr. Adam 1040 and Dr. Borgstein over at Harvard, kind of leading their regenerative medicine program. And one of the main topics of conversation was reclassifying shockwave as a regenerative therapy or a biologic versus a
Wow.
modality
Oh
because the
wow.
growing volume of literature is so extensive and so vast that even though certain devices are held to certain FDA, clearances and FDA, basically this device is approved for plantar fasciitis, and that's all that the device manufacturer can state. There's so much literature that they're looking at actually reclassifying it truly as a biologic versus considered just a modality by most of the medical community, which I thought was an interesting point.
Yeah, that's awesome.
So I'm gonna hit on one other thing that you mentioned, Jerry, is you talked about the things that patients can control. One of those
Yeah,
things is stress management, on the
yeah,
list. we've talked to a lot of people who utilize modalities, a lot of people implementing great exercise programs where they're using some of the direct current, technologies. But one of the things that I often think gets missed is that stress management piece. What does that look like for you and your patients?
Yeah. So it's fun during our discovery session. One of the questions I do ask is what your stress level is like and how do you manage it. And so for those who are more than 5 out of 10, we'll say 0 to 10. What I often talk about, what are the things, I just kind of go into general things like, is it work related, personal? And then depending on how comfortable they feel with me, we'll go into some discussion about that and say, hey, listen, based on what you're telling me, it sounds like you might need some help. And, here's some counselors I could recommend who might help you in this area of your life. So we try to kind of keep a pool of referrals as far as mental health professionals in our arsenal so that we can help this person get through. Because as you and I know, like the more stressful you are, the more likely you're going to have this chronic pain issue that you're having. The second thought is what you can do at home. And so I'm a big fan of just having time to meditate. And if you are a person of faith, then using that time to pray and whatnot to downregulate your nervous system. I have found that also box breathing, so helping clients to learn how to breathe differently, so they can really kind of gain access to getting themselves to calm down parasympathetically is also really helpful. But it's funny because what I find is that a lot of clients don't get asked these questions, Ben.
Yep.
So they don't, and so they just are sort of stuck. I guess this is how it is as an attorney or as a surgeon or whatever. As they know, man, there's a lot of things you can do. And so then when I walk them through a couple of things like that, they just feel more hopeful. And again, one more example of how we can um, be as direct access providers, just being able to talk about these things with clients on a level that helps them to build trust that we're just really trying to help them get on the journey to recovery is what we bring up there.
I found that one of my greatest referral sources has become the psychiatrist office, and quite a few
You said that
counselors
before.
just recommend my clinic. Obviously, patients come in direct access. In Indiana, we've got 42 days of direct access, and
Yeah,
I laugh because I've got counselors and psychiatrists recommending patients to come in because these patients are in their psych sessions or they're in their counseling sessions because of a pain issue. And they're like,
that's
like
crazy.
you can totally get help with this. Like, I think I know a guy, and they're like, no, I've been everywhere. And it's just funny to
Oh,
have
nice.
the role reversal, of the counselor or psychiatrist
Yes,
advocating for
it's
your
fun.
type of care that you provide. And so anybody who's listening, Jerry, you can take that with to the bank, is go to your
Yeah,
local places that you're referring to and just educate, like, hey, we have a lot of patients that have chronic pain. These are some of the conditions that we see, or athletes who may be spiraling because of an injury. We just saw that,
yeah,
the catastrophic injury in the Olympics, just the
yes.
mental toll that can play on an athlete, and it opens up a new referral source for you if you haven't thought about that yet.
Oh, definitely. That's something I haven't thought of. So I'm glad you brought that up.
Yeah, definitely.
I mean, even some of since we were, teaching at your clinic in New Jersey, a lot of the needling that we've been showing in the orthobiological hacker certification has really been directed more towards anxiety, sleep, recovery,
Really?
a lot of that stuff, which,
Yeah,
yeah, is really cool and way more evidence in the literature, than what you would think. And what's fascinating to me is just looking at all of these, points that have been used for years and years and understanding the physiology of that. And yeah, I mean, just to your point, obviously that's a really, really big deal.
yeah. I have a question for you, actually, Ray, and for Ben too. Do either of you find that we can use regenerative tools like the shockwave or adrenaline for athletes as a recovery program, or does it have to necessarily be for somebody who's always in pain?
Ray, you're not allowed to talk about the Krebs cycle, but you can go into your spiel. You can talk about
Well,
your spiel on memetics. Go for it.
so I maybe I want to make sure I understand the question, but I think what you're asking is is dry needling a useful tool when it comes to regenerative medicine, used in addition to shockwave and laser
For recovery?
so you're talking about not just getting tissue to heal, but also like recovery of like
Yeah,
athletes and patients to get to the next
exactly. Yeah.
100%. Yeah, yeah,
Okay.
yeah. No, I
That's what I
mean,
thought.
there's a whole
Yeah.
body of literature just on that. I mean, upper extremity, lower extremity. In fact, I mean, without getting too crazy about it, I mean, there are certain points that you really can use in order to like turn on a lot of the genetic cascades and upregulate, you know, a lot of the same transcription factors that are responsible for tendon healing, connective tissue healing, and right, muscle, like all of the things that you would need in order to be able to push a better recovery response, get through DOMS, and then obviously be able to perform again sooner.
Yes.
But in all honesty, it's the way that you do that is different than the way that you would use needling in order to be able to treat pain, right?
Yes.
But that is absolutely the conversation that's worth having, right?
Yeah.
Because a lot of people really aren't thinking about it in that way.
Yeah.
But yeah, super cool. I mean, there are
Yeah.
points that are considered the master points of recovery, the master point of tendon repair, I mean, master point of angiogenesis, all of these things that you need for recovery. It's just you have to be able to think outside the box and make it your business to understand the physiology, I think,
Yeah.
of needling a bit better. But if you
Mhm.
do, I think it opens up a whole nother window of
It's
recovery.
wild. Yeah.
Jerry,
I
I
love
find
that.
myself for a lot of, athletes, especially those that have recurring injuries, maybe an
Yeah.
athlete had a high ankle sprain last season, or, maybe they ended up having a rotator cuff, partial tear. I definitely would advocate for utilizing some of those modalities like shockwave and others. I generally don't do it within the window of competition. I'm not a big
Mhm.
fan of like same day, hey, I'm going to do a huge needling session and other things in the morning, and then you're going to
That's
go
right.
compete in the afternoon because I've seen it marketed. I've seen clinics that
Oh.
are doing that, and I just
Mhm.
would advise not doing that, especially because athletes, they're always in their head, right? They're they're
Yes.
always thinking and psyching themselves out, and
Of
if
course.
they're not feeling up to par and you just treated them, then they're going to say, well, maybe that
Oh.
guy,
Yes.
even if it's just
Exactly.
a psych related thing.
But I'll tell you
Absolutely. Yeah.
that if you have those sorts of patients that that you really want to be able to use same day and you really want to, have a much shorter turnaround, it's really all about laser. Like
Yeah. Oh, yeah.
the coolest studies when it comes to recovery is laser or
That's
performance,
crazy.
I think.
Wow. Huh.
And it doesn't even have to be like the high intensity laser, even a lot of like low intensity stuff and LED and all of that.
Mm.
I mean, you see optimal performance when it comes to cardiorespiratory athletes like cyclists, you see it in strength athletes. Like, yeah, I mean, I could go on and on about performance and laser. Really cool stuff.
Yeah. That's crazy. I didn't. I actually hadn't associated that with performance, more just with recovery. But
Oh
that's interesting.
no. Yeah. Well, I mean, just as a teaser, I mean, it helps you to it helps you to recycle, all of the byproducts when you break down phosphocreatine. So it allows you to basically use them again quickly and
Mm.
then be able to replace it in significantly less time.
That's
Um,
crazy.
and it takes a lot of the acid byproducts of glycolysis, and it allows you to recycle that in a way where you can actually use it to your advantage in the mitochondria in order to be able to feed the Krebs cycle and then ultimately the electron transport chain. So
Wow.
yeah, like laser and recovery and performance is super cool.
Yep.
We've actually been talking about just doing a class on that.
Oh,
Um,
wow.
because there's so many athletes that, obviously they want to up their game and be able to,
Yeah.
do things. Or the other big one that we like to talk a lot about when it comes to performance is the non-invasive brain stimulation, right? So
Yes.
this is kind of along the same lines as the Halo and CrossFit, or,
Mhm.
which is really just an application of transcranial direct current stimulation,
Yeah.
but super cool stuff. I would tell you about
That's
it, but
awesome.
since now we may be competitors in HYROX, I don't know if I can.
Unless we partner together.
Exactly, exactly.
If you partner
That's
together,
awesome.
Jerry, Ray may have a heart attack.
Whoa.
I don't know, Rick. I think Rick can hold his own.
Back in the day, I used to be pretty good, but I did just turn 50, so my
Hey,
days are numbered.
I'm only a year ahead of you, so
Yeah.
So Jerry, just to recap, we wanted to have this discussion just to kind of go over, kind of cracking the code with the aging athlete. And I would say main takeaways, for me from just discussing with you is one, having a clear cut path forward, building out a program that's not a cookie cutter program. It's uniquely tailored to each individual client, maybe even sports specific. And really giving the patient the option of, hey, we can try the traditional track, or we can go in the more regenerative tract. It sounds like you are referring out, for peptides. It sounds like you are having discussions on nutrition and supplementation and sleep,
mhm.
stress management. I mean, I think you really have, cracked the code, because most of the literature that Ray and I have summarized and put together for the orthobiological hacker is not only do you have to marry all of those things, but you also have to marry all the modalities. And with what you're doing with blood flow restriction therapy, electric dry needling, I think I even saw you do have, class 3 or cold laser,
Yes,
and the shockwave devices. I mean, the only way forward, I think, with the aging athlete is a combined multimodal approach. So I would say
yeah.
kudos to you for figuring that out. It's been fun
Thank you.
watching the next level physio journey. I mean, I forget the first time that I met you. I mean, I think I was teaching a course, and we
Yes,
did end
Charlotte.
up, meet, oh, in Charlotte, yeah. And
Yeah.
it just watching, oh man, like this guy has a podcast, and tuning into episodes and listening to him, and following it to see just how big you've grown, but then also just the impact that you've had on people's lives. So I really appreciate you taking the time to be on the call with us.
Oh, my pleasure, Ben, and thank you again for both you and Ray having me. And you guys have been back to my way of practice, and it's funny. Anytime anyone asks about dry needling, I mention either Ray or Ben, like, "Oh my God, I can't believe you actually excite people to be glad they chose this profession." So it's really glad to be a part of your lives as well, and seeing your journey with OBH and everything in Sorentia.
Thank you.
Awesome.
Thanks, Jerry. Yeah, truly
Yeah,
you are an inspiration. And I mean, God, if we could just create an army of people like you, I think that Ben and I could actually begin to create the change that we like to talk about in class and in the profession, you know? So
yeah.
thank
Well,
you.
yeah. I mean, it's guys like you who make us want to do that too. So I think it goes both ways.
Well,
So,
thank you.
well, Jerry,
Yeah.
thank you so much for your time. I really do appreciate you taking the time out of your day to be on here and be with us. And everybody, just make sure you watch the New York HYROX event. Look for Jerry.
And
We'll
eventually Ray.
It'll be me facing down the floor.
So, well,
Oh,
thanks so much, guys. I appreciate it. And this webinar will be available to be viewed within the Trencher Tribe under the webinar archives. If you want, please feel free to check out some of the other podcasts and things that we're shooting. Ray has been continuously putting out new content, Jerry, just so you're aware, in terms
yeah.
of tendon loading. I mean, he's getting ready to do a
Oh,
big
nice.
tendon
Yeah,
webinar that's going to be released. And we've got some other needling and other webinars that are up and coming. So we'd love to have you tune in for some of those.
absolutely, man. Thanks so much for that.
All right. Thanks, guys. Have a great night.
You too. Thank you too.